All right, welcome back to Pharmacist on Call. Your host, Dr. Shawn Pruitt, Community Pharmacist of the World. Hey, briefly, I did want to mention something, fellas. We've got something in store. If you were trying to get it in and you're having issues with ED, let me recommend this fella here, Legend, and it is selling like hotcakes in the pharmacy. This is an herbal formula that helps with ED, but not only does it help with ED, it lasts 4 to 5 days. So this stuff here is the flood in the pharmacy to get. In fact, I think one guy came and bought like 16 pills last week. So you guys, if you're trying to get your game up, come and see us about Legend. All right, and so we want to talk about diabetes for a moment, because since it's the problem that we have with COVID disease, for that segment of the population, they are immunocompromised. And so those types of comorbidities, that heart disease, kidney disease, those things make you more vulnerable to the first COVID infection. Right now, this Omicron is kind of mild, but I promise y'all, there's some stuff coming down the pipeline that is going to be pretty serious. So I want to make sure that our blood pressures are in check, our cholesterols are in check, and our diabetes, our A1Cs, what have you. So let's do it on the front end. Beetroot juice will take care of your blood pressure and your diabetes and your cholesterol and your liver and your pancreas. So this stuff is a superfood. It does a number of things. So you do a capful every morning on an empty stomach. Some people do 1 capful in the morning and in the evening to make sure that you absorb it. It gives the pancreas what it needs to function properly in terms of your blood sugar. And what it does to the blood vessels of the heart, it opens them up, causes vasodilation, so that the heart does not have to pump as hard to get blood through those small vessels. So beetroot juice in combination with alkaline water. We've had a number of patients transition off of their medicine naturally. I even had a physician come in and thank me for getting his patients' A1Cs down, because they all started telling him what they were doing to get their A1Cs down. And I guess our name kept coming up. He popped by the pharmacy and actually bought some himself. So beetroot juice is pretty serious. Nature has had a history for millennia for taking care of what you need. All right, looks like we've got one coming in here. Nancy, welcome to Pharmacist on Call. Let me help you.
Hi, is this you?
It is me.
Okay, I have a question.
Yes, ma'am.
Does calcium pills, or a lot of calcium, can cause UTIs or bladder infection?
I don't know, you stumped me on that one, but I can't see physiologically how that would be possible, but I guess It could be, yeah. So that one I'm going to have to research, Nancy.
Okay.
So what kind of spurred you to ask that? Is someone who's supplementing with calcium developing them?
Yeah, I was on a lot of calcium. I kept having UTIs and bladder infections and all that. Mm-hmm. So that's a while ago, the doctor said, well, it could be because you're taking calcium.
Okay.
But then I also had kidney stones, so he removed those, and I'm a little bit better now.
Okay.
So calcium, it scares. I want to take it, but it kind of scares me. So what do you think?
What are your calcium levels looking like?
I don't have no idea.
Okay. I would go by that. Now, were you supplementing with calcium?
No. Well, that's when I was having the UTIs. And that's when he said, well, maybe you should go up a calcium.
I think I trust him on that. Yeah, but yeah,
really?
that's one. Yeah, that's one of the ones you stumped me on. But give me a call at the pharmacy tomorrow. I'm going to research that. I've never heard that, and I can't even think of the pathophys on that. So calcium.
I'm going to continue to take it. Thank you for taking my call.
Yes, ma'am. You're welcome. Thank you. All right. Bye-bye. Okay. Linda, welcome to Pharmacist on Call. Let me help you.
Yes, this is Linda, and I have a quick question. I'm taking the beet juice, and I'm also taking a blood thinner. Is that dangerous to take the two together?
I think that it can enhance the effects of your blood thinner. What blood thinner are you taking?
It's, I knew you'd ask me. CLOPIDOGREL, 75 milligrams.
I think you're okay with that. The blood thinners that and that's more so an anti-clotting Well, I guess it'd be blood thinner, kind of. But the ones that would concern me would be warfarin, Coumadin.
Okay. So I haven't taken it until I talked to you because I was kind of scared because my neighbor said, no, that's too dangerous. It'll make your nose bleed, you'll hemorrhage, and all kinds of stuff. You know how neighbors are.
Yeah, neighbors are pretty good with that health information. Okay.
So you think this would be okay then?
Are you being monitored, ma'am, for your like your INR, your PT?
You mean do I go back and have my checkups?
Yeah, just to see how thin your blood is.
Yeah, I went back last month, and
Okay.
he said everything was fine.
Yeah.
And
Now, how long had you been on the Plavix?
I've been on it for a year.
Okay. I
I
think,
hate that.
yeah. I would ask them the next time you go, keep taking the beetroot juice with the Plavix, and just ask them, are you still at risk for blood clots?
Okay. Because, see, when I went in last year in January, my blood was thick as Jell-O. And so that's the reason they put me on this blood thinner. It was real thick.
Did you, have you had COVID?
No.
Okay. Yeah, because that's one of the main symptoms, that blood hypercoagulating.
Okay.
How much water are you drinking?
Oh, I drink lots and lots and lots of water.
Okay. All right. Yeah, I continue on the beetroot juice and the Plavix.
Now, should I take a capsule of that or take a smaller amount?
Nah, you can do a capful. That'd be just like your
Okay.
doctor telling you, hey, I don't ever want you eating beets again.
Okay.
So he didn't say that. You're good to go.
Okay, thank you so very much.
Yes, ma'am. All right. Thank you for the call.
Bye.
All righty, brother. Okay. Drew, welcome to Pharmacist on Call. Let me help you.
Yeah, well, what's the best way to treat, what are the best vitamins for leg pain, and what's the best treatment for diarrhea?
Okay, you said leg pain.
Yeah.
What's it coming from? You on blood pressure medicine?
I'm a little bit over, I have a birth of normality. My leg is kind of split in half in the right leg.
Okay. All right, then I would recommend this for you, sir. Our CBD hemp oil. Are you on chronic pain management?
Well, I take aspirin, and I try vitamins. I do have some vitamin deficiencies.
Okay.
Vitamin D deficiencies.
Vitamin D deficiency? All right, so we're going to need to supplement with D too, okay?
Okay.
And I would say,
And what about diarrhea? What would you recommend to stop diarrhea?
you could just get some Imodium AD over the counter. Now, is this something you suffer with a lot, or is it just this particular instance that you're kind of dealing with it?
The last couple of days, I've got the Bismol work just as good.
Nah, I don't think anything beats Imodium. But you could try it if that's what you have at home. Yeah, but I think loperamide, which is the generic for Imodium, will work better. But yeah, try the Pepto-Bismol. Now make sure you're keeping yourself hydrated too, because you can become dehydrated, and that can also cause further leg pain by cramping because you're deficient in, potassium and magnesium.
And vitamin D can really hurt your leg pain. Make it hard for you to move.
Vitamin D deficiency? I don't know, but it's possible. But yeah, you're going to need to be on vitamin D, man, especially during this season. And it sounds like you're in the house a lot. So I'd say about 5,000 units daily for you. You're just not getting the sunlight that you need. So that, and for the pain, CBD oil. So give us a call at the pharmacy. We ship nationwide, and we can square you away, okay? Okay. Anthony, welcome to Pharmacist on Call. Let me help you.
Yeah, this is Anthony. Thank you for taking the call.
Yes, sir.
Doctor. Ever since I've been going to this VA doctor, it seemed like he wanted to prescribe all kinds of medicine. I started off when I went to him, I had to take 3 prescriptions. Now he got me up for taking them almost 13, 15 prescriptions. It's hard to keep up with,
Yeah. So what conditions is he treating you for?
Well, he got me on pregabalin, and
Okay.
he said That's supposed to be for the nerve pains and stuff like that.
That is.
Then he got me on this gout medicine, this colchicine.
Okay.
And this colchicine is allopurinol. But see, they were training a new doctor, a black female African doctor. She came in there with him one time. He said, you got to be careful about that colchicine, and then it mess your kidneys up. And then he's quiet enough, and it wouldn't let her talk no more. And ever since then, she was right.
Well, let me ask you this. In the interest of time, are you able to drive?
Yes.
Okay. So we're going to get you off of the colchicine and the allopurinol, and we're going to fix gout altogether, okay? All right. So
Right.
the first thing we're going to do is avoid the trigger foods. So the shellfish, the dairy products, so that's ice cream, milk and cheese, is going to flare it up. Red meat is going to flare it up.
Right.
Anything tomato-based, so pizza, lasagna, spaghetti, that's right, all the good stuff.
Oh, man, you just messed me up now.
No,
Yeah.
all is not lost. There is hope, young man. If you must,
What about this?
if you must
What
eat
about
that,
this blood thinner you got me on?
well, we
I've been taking it almost about 3 years, and they ain't doing no good. My legs is burning and pain every night. I mean, every day and night.
I got you. I got
The
you.
gablet's not doing no good. This Redaxo's got me on.
I got you. So,
that's
sir,
the
what you
blood
need to you need to come and get some alkaline water, okay? And that will neutralize the acid in your joints. Part of that is gout pain that you're experiencing and inflammation. So the water is going to resolve the gout and the inflammation, okay? Just the right type of water and avoiding those trigger foods. If you got to have them, then you're going to need to drink more water to prevent that gout from setting in, okay?
Yeah, but Dr. Pruitt, one doctor called the other doctor and told him to cut me off of certain medicine. Like, he overruled the doctor of my primary physician. He said, don't give him stop him from them aspirins. He don't need them aspirins no more. Why you giving them to him? Why you taking them? He prescribed them. Well, he don't need to take them no more.
Well, listen to your primary care
now I'm
doctor.
taking aspirin. So, so now I'm not. They cut me back on the vitamin D. They done did all this. If I brought that down, I'd need a suitcase to bring the medicine healings.
I tell you what, you come see me. You come see me. We'll probably have to have a consultation. So you come see me and we'll talk, okay?
I really need some of that medicine you were talking about on TV while ago, easy and all that other stuff.
Oh, the legend. Yes.
Yeah, I appreciate you advertising. I don't hope it ain't too much going around my pocket because I ain't got a sack of money now.
No, $9.99 a pill. So you're going to get 4 to 5 days of coverage.
Well, yeah, I can deal with that, but they gave me this other stuff. And I mean, you see this stuff come in a freezer bag. Mm-hmm. Yeah, I mean, you know what I'm talking about? It come in a freezer thing, freezer cooler.
Yeah, but...
You're supposed to insert that and all that.
Oh, Caberjack. Nah, it's okay. Yeah, no, thank you. Yeah, injections are not cool. But look, let me get to the next caller here because the show is winding down. I want to make sure we get to everybody.
I want to come over and see you. Do I need to bring this stuff to you or what?
Yeah. So we'll kind of have an idea of what you're taking.
Okay. Thank you, Dr. Pruitt.
Yes, sir.
Appreciate it.
All right. Thank you.
Mm-hmm.
All righty. Bye-bye. All right. Stay right there. We'll be right back.